Hello. So after looking at your abdominal CT scan and your colonoscopy, it looks like you're having another flare of your diverticulitis. And I know that you've had them before, but I just wanted to explain that it came from diverticula, which are pouches in your colon that can occur due to low fiber intake. And then diverticulitis, it's not really sure how it happens, but it's when one of the pouches or diverticula becomes inflamed and it's getting irritated, so it causes you to have all of the symptoms that you're having. You're more likely to have these diverticulitis flares having episodes in the past, which you have had, or not including enough fiber in your diet. So we want to consider a sigmoid colectomy. And a sigmoid colectomy is essentially where they take out the part of your colon on the left side. It is the most likely site to have diverticulitis. And the most common reasons why anyone has this procedure is, in your case, severe diverticulitis, irritable bowel disease such as Crohn's disease or ulcerative colitis, and colon cancer if you have it on that side. So for you, I know that we've tried antibiotics, we've had diet changes to modify for more fiber, and we've tried to manage your pain. And I know that this is the third flare that you've had, so you're kind of leaning more towards having better effects or results with having surgery. And overall, what will happen is they'll use a robot and make little incisions in your belly. They'll put the instruments in, and then the surgeon will use the instruments to find the parts of the colon that he wants to dissect, making sure that everything's okay. They'll even look at your bladder to make sure there's no holes or a concerning fistula, which would be like a passageway from your colon to your bladder. And then after he's finished dissecting, we take out the instruments, we make an incision below your belly button, we look in, we pull out the diseased colon with the diverticulitis, and then we make sure to attach the ends of the colon that are left back together, and it's called anastomosis. And that is to make sure you still have a functioning colon after we take out the sigmoid colon. And then that's all, and you're finished. So the alternative of not having the surgery would just be adding more fiber, staying hydrated, staying active. But I do think that you would benefit more from the surgery just in your case with the amount of flare-ups that you've had and the severity of your symptoms. I did want to talk about the risks of the surgery. So the four main risks with any surgery are bleeding, infection, complications with anesthesia, and damage to surrounding organs. So those are, like any surgery you have, that's what's going to happen or could possibly happen, And the one specific risk with this procedure is an anastomotic leak, which is where the two colon sites that we poke back together could leak bowel and cause infection and other things. You are closely monitored after surgery to make sure that that does not happen, and it is not very common, but it is something that could occur. And then other post-operative complications that you could have after surgery, including but not limited to respiratory failure, cardiac failure, stroke, clot, C. diff, colitis, and a UTI, as well as infections you could get in the hospital. Again, we're going to do our best to prevent this, but it is possible, and we always just want to tell patients before the surgery and make sure that you know what you're consenting to. So overall, the benefits for you, I would say that you're way less likely to have another attack, a diverticulitis flare after the surgery, because the part of the colon that was causing all of these symptoms and has a diverticulitis will be removed. And then afterwards, it is a possibility that you have one, but the likelihood is way lower. And we would also be with you post-operatively to follow your journey, follow your health progress, and encouraging you to eat fiber or other possible treatments that would help you along the way. Thank you.